My topic is diverticulitis. Brian Smith is a 56-year-old male of European descent. His diet consists of mainly red meats and high-fat foods with minimal fiber-dense foods. Brian has been a smoker for 30 years and suffers from obesity. 6 weeks ago, he was diagnosed with diverticulitis after visiting a GP for the concern of constipation and was cleared after prescription of antibiotics to achieve treatment. Brian has further recorded history of acute cytomegalovirus infection. Recently, he has continued to experience fever-like symptoms and pain in his lower left abdomen. He reportedly has taken ibuprofen to manage this pain whilst working at his desk job where he is sedentary for 8 hours a day for 5 days a week. Due to his past diagnosis, the GP took a blood test showing an increase of white blood cells, indicative of an infection or inflammation in the body. An abdominal exam found hard matter in his lower left abdomen during palpitations and tenderness in the area indicating presence of an abscess. Lastly, the GP proceeded to run a CT scan over the abdominal cavity, which clearly displayed images of an abscess, inflammation of diverticula, and in contrast extravasation, resulting in his diagnosis. Whilst there is no direct causation for diverticulitis, risk factors can eventuate or simultaneously occur to increase an individual's susceptibility to diverticulitis. Modifiable risk factors include obesity and lifestyle choices such as smoking and lack of physical activity. Furthermore, a diet that is high in fat yet low in fiber is another significant risk factor, as the consumption of lots of red meat, processed foods, and refined grains all have inflammatory agents that can cause a flare-up and eventuate to diverticulitis. Fiber limits the risk of diverticulitis by assisting with bowel movements and minimizing the pressure buildup as the colon as it softens waste, minimizing inflammation during digestion, which is supported through the following figure. Taking NSAIDs can impair the gastrointestinal mucosa as it inhibits prostaglandin synthesis, resulting in inflammation. By inhibiting prostaglandin, mucosal permeability in the colon also increases as mitochondrial function is altered, allowing for bacteria to enter the organ and cause infection of the diverticula. Elderly people suffer from a higher risk in developing diverticulitis when compared to the younger generation, as 40% of diagnosis is recorded from patients above 60 years old compared to only 1 to 2% of diagnosis for under 30 years of age. This is due to a result of many age-related physiological changes within the body, such as the colon's loss of structural integrity, allowing for tearing to occur. European and Asian backgrounds yield a higher risk of obtaining diverticulitis at specific points of the colon. This is due to diet, genetic differences in organ structure, rate of diagnosis, or even the longer life expectancy. Previous diagnosis is also a high risk factor, as 9 to 25% of previous patients experience recurrent diverticulitis. Often this is due to the unfinished healing process of the last episode or the presence of asymptomatic diverticulosis still in the colon. Diverticulitis is asymptomatic diverticulosis that has progressed through infection or inflammation. Diverticula are small pouch-like defects in the colon wall that originate as asymptomatic and are very common to occur with age as the colon wall experiences aging effects, weakening the overall integrity of the large intestine, typically affecting individuals above 50 years of age. The circular muscle layers of the colon form fragile areas where the blood vessels provide nutrients to the mucosa, as it is the thinnest portion of the wall. It is estimated that genetics increases the risk in developing diverticular disease by 40 to 50%, which is evident in Brian Smith, who is European, as they hold the greatest risk factor for diverticulitis. Aging also increases the risk for individuals above 50 years of age due to the weakening of the colon wall and greater interluminal pressure, increasing the susceptibility of tearing and perforations in the diverticulum to occur. CT scans identify inflammation and even contrast extravasation in the case of perforation that indicates diverticular progression, which is evident through Brian's diagnosis. Age further decreases the immune system's response efficiency, which is displayed through Brian's blood test, which showed an increase in white blood cells, indicating that the presence of inflammation or infection, acting as an early indicator for diverticulitis when paired with his other symptoms. Delayed immune responses may also contribute to the formation of abscesses. Brian Smith shows this as his abdominal exam palpitated a lump in his lower left abdomen that signifies the presence of an abscess. Diverticula may also result from abnormal colonic motility, including intestinal muscle spasms or dyskinesis that generally develops with age. Abnormal colonic motility produces amplified muscular contractions and increased intraluminal pressure, further allowing for segregation of the colonic lumen, forming chambers that can be visualized on CT scans with present spaces in the colon. NSAIDs can inhibit the production of enzymes that contribute to gastroprotective prostaglandins in the colon, directly altering the gut microbiome and colonic motility, as prostaglandins assist with the overall structural integrity of the large intestine. When paired with a low-fiber diet and sedentary lifestyle, as seen in Brian Smith, digestion is altered, causing a buildup of food particles in the colon that can easily be trapped into inflamed diverticula and therefore progress to diverticulitis. Generally, the diverticola form in the left sigmoid region of the large intestine. This is because this area has the smallest diameter yet the greatest intraluminal pressure, which increases the likelihood of diverticular formation. Food matter in the colon can also contribute to the gradual decay of the diverticular wall, as the presence of these particles increases the luminal pressure. Subsequent pressure in a localized area creates inflammation and potential focal necrosis, leading to further complications such as perforations. A high-fiber diet is optimum for the gut microbiome as it supplies energy to intestinal microbes that stimulates the short-chain fatty acids to create mucus and antimicrobial peptides that increase overall biome diversity and digestion. Individuals consuming 30 grams of fiber a day have at least a 41% reduced risk in developing diverticulitis. When sufficient fiber intake is not met, the gut microbiome loses diversity and function in digestion, which can lead to constipation and the buildup of food matter in the diverticular wall. Alterations in this microbiome leads to an imbalance of serotonin and acetylcholine, impacting overall digestion. When food particles traveling through the large intestine become bound to the diverticula that have formed in the colon wall, it creates infection and inflammation in the colon, known as diverticulitis. History or presence of cytomegalovirus infection in the body may also contribute to increased inflammation of the diverticula, enabling progression to diverticulitis. Due to diverticulitis starting as asymptomatic, once the diverticula become infected and inflamed, many signs and symptoms arise in the patient, which include abdominal pain, fever, and either constipation for 50% or diarrhea for 35% of patients. Severe complications can occur when diverticulitis progresses and is left untreated. This includes perforations and abscess formation, which can be read about here. CT scans can be used to determine whether ruptures or abscesses are present in the abdominal cavity, and an abscess may also be felt with abdominal palpitations for 20% of patients. Medical history that can increase the risk of developing diverticulitis could be from previous diagnosis or the cytomegalovirus infection. Some signs and symptoms that contribute to diverticulitis formation could have been from low-fiber diet, lack of physical activity, smoking, obesity, fever-like symptoms, or severe abdominal pain. All of these symptoms are seen through Brian Smith, indicating diverticulitis as the appropriate diagnosis. Here is my annotated reference list.